and welcome to our special show. I am Priyanshi Sharma. Life is valuable and precious. Being able to revive a person's heart to save their life will provide one with immense satisfaction. It's a sad but a true fact that the number of people dying from cardiovascular diseases is steadily rising in India. Now, most of these cardiac deaths are sudden and on the spot. It is possible to prevent these sudden cardiac deaths if they receive immediate medical attention and CPR. The recent incidences of some celebrities collapsing suddenly and passing away due to a heart attack are concerning and shocking. There is an alarming rise in the number of young patients with heart attacks and sudden cardiac arrests. What is equally scary is that sudden cardiac deaths may happen in people who have no known history of a heart disease. The risk is higher for patients with existing heart diseases. In almost every family, we have at least one family member with a heart disease. Can one make himself or herself capable enough to save a life in an emergency situation? The answer is yes. It is possible if you're well trained in CPR. Many adults in cardiac arrest can be revived with intact neurologic function if the bystanders provide them immediate CPR. Raising public awareness and understanding of the practical applications of CPR is an essential strategy to increase the success rate of CPRs in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest, train them on CPR, and highlight the role of CPR in saving a life. Today we have with us eminent cardiologists who can help us understand the sudden cardiac deaths recently and the role of CPR to revive and save a life. Let me take a moment to welcome our guest, Dr. Dibya Ranjan Bahera, who is a consultant of cardiology at AMRI hospitals in Bhubaneswar. We also have Dr. Harsha Jeevan, who is an interventional cardiologist of Medical Trust Hospital in Kochi. And we also have Dr. Ranjit Patil, who is a consulting and interventional cardiologist at Baner Heart Institute in Pune. If I can come to you, Dr. Bahera, first. Cardiovascular diseases are the leading cause of death worldwide, and they also have one of the most expensive treatments. Which cardiovascular diseases are preventable and which are not?
Yeah, good afternoon, everybody. You know that cardiac diseases are on rise day by day, and many celebrities are already told by the anchor that it is on the rise. So we should know that which are preventable and which are not preventable. Most of the cardiac diseases are preventable. Except the genetic ones and those who are there from the birth, that we called as congenital heart defects. So those diseases are not preventable. But apart from that, majority of the diseases which we acquire, and that is called as atherosclerotic coronary artery disease, atherosclerotic cerebral vascular disease like stroke, brain strokes, and heart attacks, they are largely 99% preventable. So if you take good amount of rest, you do regular exercise, you do a proper lifestyle, and you regularly check your parameters regularly, then this preventable disease is largely prevented. And today this is rise the heart attacks, and that is the most common cause of death worldwide. You know, the most number one killer, if you tell, it is heart attacks. But although it is number one killer, it is 90% preventable. So we should be aware of that.
Important to note here. And also, Dr. Jeevan, heart health deteriorates with age, but still we can see that aged people who are perfectly healthy without any cardiac ailments. What can be the reason behind it?
Good afternoon, everybody. Happy to be on the show. It's an interesting question. The first thing to say is if you've got good genetics, that you've got very good ancestors who have got very long lifestyle, if not have heart disease, there's a good chance that if you are taking care of your heart health by having, like Dr. Behra, a good healthy lifestyle, balanced diet, stress reduction with yoga and meditation, all these go a long way in your heart health. An important thing to remember is that you have to keep checking on your heart once in a while. That is, you check if you've got blood pressure, sugar, if you've got cholesterol. All these things actually play a role in making a block. It's essentially a fight between the blocking process or the atherosclerotic process and the body's defense and your lifestyle. So if you have a good lifestyle which is able to overcome these other factors like stress or hypertension and dyslipidemia, that is cholesterol levels, then you tend to have a longer, healthy heart. And that's essentially the aim over a long period of time. And if you find that there is some kind of a disease, for example, a block, you can look for further testing like an echocardiogram or a treadmill test. This will give you an idea. You need to go for further invasive testing like a coronary angiogram to look at the blocks and, if necessary, treat them. The final pathway will keep your ejection fraction or your heart pumping as good as possible. And that is what we need to do over a long period of time with these checkups.
So definitely great advice for all of us to remain healthy for longer. And Dr. Patil, sleep apnea is a potentially serious sleep disorder. Is there any link between sleep apnea and heart disease? And how can someone prevent heart diseases if he or she is suffering from sleep apnea already?
Yeah, good afternoon. You have thrown a light on one of the most neglected issue with cardiovascular diseases. Almost incidence of sleep apnea is double in male as compared to female. It's like 34% of male affected and 17% of female. Sleep apnea and heart diseases has got a close link in the form of patient can have resistant hypertension itself because of the obstructive sleep apnea syndrome. Patients can have cerebrovascular events, heart failure, arrhythmias. It can be heart rate fast arrhythmia or slow heart rate arrhythmias and coronary artery disease. Most of the time, this patient, they will present with snoring, excessive sleepiness during the daytime, and in the night time, whosoever is sleeping along with them, they will notice that there is a pause in their breathing activity, and suddenly they will start rapid breathing. So something which can be very well easily diagnosed and most of the time neglected condition is obstructive sleep apnea. Now, almost 30% of patients who are hypertensive, they will have obstructive sleep apnea. And if your blood pressure is not controlled despite of taking 3 antihypertensive medicine, of which one is a diuretic class of the drug, almost 80% of them, that is called as resistant hypertension, will have obstructive sleep apnea syndrome. Coronary artery disease itself is because of the obstructive sleep apnea syndrome aggravated as there is increased demand of oxygen and there is a fall in demand of oxygen to the heart and excessive demand of oxygen requirement for the heart, which is contracting vigorously against the high blood pressure itself, and this heart is hypertrophied heart. Almost 60% of patients with obstructive sleep apnea syndrome will have heart failure, and as I discussed, sudden cardiac death because of the obstructive sleep apnea syndrome in the form of arrhythmias, which are predominantly, these people will have underlying heart disease, these people will have intermittent hypoxia, that is low oxygen, they will have acidosis in their body, this patient will have excessive sympathetic surge, and another etiology is excessive change in intrathoracic pressure, which is responsible for these arrhythmias. This obstructive sleep apnea is aggravated if you are lying down on your back and if the patient is alcoholic. This is very well prevented, can be diagnosed by doing the sleep studies either or clinical diagnosis also. This patient can be treated by some small surgical corrective procedure or some machines like CPAP machine for obstructive sleep apnea. We can very well prevent this death and we can prevent sudden cardiac death if treated and diagnosed rightly. This is one of the most neglected topic of sudden cardiac death.
Right, of course, it's as you mentioned, one of the most neglected topics. Now, my next question to you, Dr. Behera, heart attack has remained a major health concern around the world, but it is only recently that a rising number of heart attacks among the young population are being reported. So why have heart attacks become so prevalent among young people?
So this is very, very important question, particularly for today, that many young celebrities, young persons are dying. You know, India is a country which is transforming from developing towards a developed country. So many people, and India is full of young population. So, but the problem is this young population are under a lot of stress. They are thinking that overnight they will achieve their goals, and for that they are under a lot of stress. The First, we should know that what are the causes of heart attack. So the number one cause is diabetes. India is now the diabetic capital of the world. So almost every alternate person in our country, every 1 in 3 person in our country is diabetic. So if you are not properly controlling your diabetes, you are giving rise to atherosclerotic disease or heart attacks. Second most important factor is blood pressure, high blood pressure, which called is that hypertension. If you are not properly checking your blood pressure and neglecting it, so also this blood pressure is also known as the silent killer of the your silent killer. So it is number two cause. Number third cause is high cholesterol, or we call it dyslipidemia. So that LDL cholesterol, which is the bad cholesterol, if it is increased and that is deposited in your coronary arteries, and they amount of coronary artery blockages, and leads to stroke or heart attack. Number fourth cause is smoking. Every this out of stress or out of something, this particularly the young mass, they are very much fascinated towards smoking and also many illicit drug abusing. So these factors lead to sudden spasm in your coronary artery. That means coronary artery suddenly go into spasm, or it is suddenly the area is decreased. It is completely blocked, and you get sudden heart attack. Number fourth cause is stress, which I've already mentioned. Then this is the next cause is the increased sedentary lifestyle. Many of the youths are doing work from home, particularly in Corona era. And when doing sedentary lifestyle, they are particularly resting at home. They are doing an office job in a table and chair. They are not doing any kind of exercise. So the sedentary lifestyle is also equivalent to smoking. So there is a very lack of exercise. Abdominal obesity, many of their children also now starting taking many junk foods and all. They are taking so much of obesity, particularly the fat around your belly, that is known as abdominal obesity. So all these things, all these factors, along with alcohol, all illicit drugs, above all, your awareness level is less. You are not properly checking your blood pressure at particular time. You are not checking your sugar at time. So if all these factors being checked and being properly monitored, and you take adequate steps to then this will not happen, that your heart attack will never happen. And you should decrease particularly your sleep. You should that nowadays so much of social media and all very common source of stress and anxiety in young people. So all those things, if you properly maintain and properly regulate it, it will definitely prevent the incidence of heart attack in today's era.
Right, that's very important advice, of course, for all of us. And Dr. Jeevan, many heart attack patients die before they reach a hospital. And the sooner the person gets to the emergency room, the better the chances of survival are. So prompt medical treatment reduces the amount of heart damage. So can a person help himself during a heart attack? And in how much time should the treatment start?
See, ideally the treatment should start immediately. The first question to answer is, are you having a heart attack? So you need to know the symptoms of a heart attack. If you're having a chest pain, which is quite severe, it's radiating to your shoulders or your arms, to your neck or to back. If there is association, you're feeling giddy or there is a loss of consciousness, it means that there is something seriously wrong. You need to most of the happens when people think about it as a gastric problem or a musculoskeletal problem, and they think we'll wait it out, let's see how it goes. So the first rule is, if you have a doubt, any of these symptoms, go to a doctor. That eliminates most of the delay. The second thing, most importantly, call for help. Do not drive. Call a friend or an ambulance and reach the hospital immediately. Once you reach the hospital, them your symptoms clearly, and they'll usually do an ECG as the first test, and they'll see what is wrong with the ECG, and they'll see if you've got a heart attack or is it any other common illness like a gastric problem, like I said. But if they find that there is a change in your ECG, then they'll have to proceed with further testing like a cardiac enzyme test or send you to the ICU and look for a block with a coronary angiogram, or the other alternative is a clot dissolving medication called a thrombolytic. All these actually are a pathway which has been well established, and it helps to define how your treatment strategy should be. And Once you have an angiogram, you may have one block or multiple blocks. The cardiologist will decide whether you need to have angioplasty or a stent. And the current of care is something called a primary angioplasty, where the blocks are immediately cleared, which improves the blood flow to the myocardium or the muscle of the heart and protects your heart from other rhythm disturbances and other problems. The goal is first to find out, to remember that if you have any symptoms, think about a heart attack, get an ECG, reach a hospital as soon as possible, and most importantly, do not drive, ask somebody to take you there. Another thing you should remember in this thing is, if you have aspirin, it can be chewed. If you are sure you are having symptoms, that can be one of the first medications at home. If you already have got an angioplasty or you're already a heart patient, your doctor would have given you something called a nitrate, which is under the tongue. Once you keep it under the tongue, you need to rest or lie down, don't run around, and then reach the hospital.
Right, that information of course important for all of us, and we'll just pause for a very short break now, but continue this discussion on the other side. Stay tuned. Welcome back to our special show focusing on cardiac arrest and means of preventing it. We're joined by eminent cardiologists on the show. And Dr. Patil, people spend some time recovering in the hospital after any cardiac procedure, but they need to continue taking care of themselves at home. And it may be a bit of an adjustment to go from your normal routine to adjust your activities after a heart surgery, but it can be done. What care should be taken post cardiac procedures?
This is, I think, again a very important thing, because in hospital there is always a support and assistant to you in your treatment, and whatever all your doubts and all that, they are clarified. But once you are at home, it is you, your support, home support, and at times hospital can also give online support, so that a patient should take care of himself in the form of, first, never stop your cardiac medicines. As per your doctor's advice, you should continue your medicines, and whenever he will say to stop, or he will say to reduce the doses, according to his advice, patient should follow, his treating doctor's advice should be followed. Second thing, every patient should have, in case of emergency, number with him. In case of emergency, your doctor's number, your cardiologist number, his assistant's number, or hospital's emergency room number, and hospital's ambulance number. This emergency number should be there with the patient. Third thing, when you are discharged after your procedure, let it be a bypass surgery, let it be a angioplasty procedure, you should not suddenly restart your activities. It should be a gradual resumption of activities, but you should do regular exercises, and that too under somebody's supervision. If suppose there is a cardiac rehabilitation program allocated to you, you should strictly follow to that. Otherwise, take the help of your treating cardiologist in gradual resumption of your activities. Fourth thing, I'll advise a dietary advice, as whatever is been dietary advice given to you, because lifestyle modification, as we have discussed already, gradual resumption of activity, patient should stop smoking or tobacco in any form. He should regularly check his blood pressure, blood sugar at home, because nowadays devices are available. Even cholesterol should be monitored regularly. Strict dietary advice to be followed as given by your dietitian. And along with that, patient should be involved in activities like yoga, pranayam, regular exercise, and some relaxation activities. They should meet friends, family members, they should be doing some recreational activities, they should pursue their hobbies. And one more important thing, if you are reading about your disease condition, get a proper information, because nowadays collecting information from social media and all that, that may be harmful at times. So if somebody follows these guidelines, these steps, and regular follow-up with your doctor as advised by him, by your cardiologist, I think this process will be smooth.
And Dr. Behera, it's still a grave shock to hear that an apparently a healthy person underwent a cardiac arrest. Can extreme stress cause cardiac arrest? And what are the other factors that can be responsible for cardiac arrest along with stress?
Yeah, you know that stress is one of the common factors nowadays for immediate coronary heart disease attack, that is known as cardiac arrest. What happens is that in the coronary artery there is atherosclerotic plaques, and in that plaques the upper covering is very thinner one. Once you are under immediate stress, or your body or mind cannot bear that stress, so what will happen, that plaque ruptures and that coronary arteries get immediately blocked, causing severe heart attack. So stress is definitely the most common. And second is smoking. If you smoke, also the same thing, the upper layer or the endothelium in that coronary artery is ruptured, and you get plaque rupture, we call it, and immediately you get a heart attack. Apart from that, if there is an electrical disturbances in your heart, some patients are prone for very high pulse rate or very high heart rate. That we call as ventricular tachycardia or ventricular fibrillation. That also causes sudden cardiac death, and most of them are maybe genetic. And smoking. So all those things, smoking, stress, and these genetic factors. So all those things, they make up and most of these things, they are not apparently healthy. You are telling apparently, they are actually some amount of atherosclerosis is already there. They are under some stress for some time. So don't take any stress and suddenly do some recreational activities. Try to share your feelings with your friends. Try to have a good sleep and avoid social media as far as possible. So all these things will make your life better.
Right, don't take stress. That's an important advice that comes up time and again. And Dr. Jeevan, how would a bystander, non-medical person, know if he or she is doing CPR with the right technique? What are the main steps of CPR?
The CPR is actually an essential thing which So the first thing to do is, if you have a collapse in front of you, call the person and see if there is a response. Look for any breathing. Look for a pulse. If there is no pulse and there is no breathing, you know that the patient is collapsed and you need to start CPR. The first step of CPR is to interlock your hands, and this part, which is called the palm, the base of the palm, is one which goes on to the center of the chest called the sternum. And keep your hands straight and press against the sternum. The depth is about 2 inches or so, and let it recoil in between. The frequency is about 80 to 100 per minute, and this is something called chest compression only CPR. But the first thing you should do if somebody's collapsed is call for help. If it's a bystander, ask them to bring up the helpline number, call the nearby hospital, ask for an ambulance. Until somebody who's healthcare professional comes, it's better that you do your CPR. A good response would be the patient responds and wakes up or responds to your CPR. But if the patient does not, it is essential that the patient reaches the hospital, and you need to look for a rhythm disturbance. The patient may need a shock to reset the heart electrical system,
right,
or the patient may need to look for any further cause for this. If there is a heart attack going on, or is there any other infection going on, or any other reason for this particular cardiac arrest. But it's been found that bystander CPR actually dramatically improves the number of patients reaching hospital safely and having a good neurological function. So it's something which we need to learn and teach others too.
Right. Well, thanks very much, doctors, for joining us and answering those very important questions that concern all of us. We hope it helped our viewers learn more. With that, it's a wrap on this show. Thanks very much for watching. Goodbye.